I've done a lot of talking about my personal health situation this week. It's not something I'm comfortable doing. I guess, there's that journalistic DNA that says you are not the story, but everyone is the story. Now it's a human story. It's a story of society. Society is made up of individuals, individuals learning to care for one another, individuals learning to identify with one another, which is how we make the fabric of a society. So if I've done that and it jars your journalistic consumer sensibility, I genuinely apologize. It's certainly a bit out of my own comfort zone. But before I go, I do want to make a comment about our private health insurance system. I wrote several pieces this week, but one was for the American Prospect called Health Benefit Plans Are Making This Pandemic Worse. And I think there's a reason we should be talking about that. It's kind of a simple and unfortunate one. I used to work in the health insurance, health benefits field. Back in the 1970s and 80s, the RAND Corporation, which is probably best known for its nuclear war planning, did a comprehensive, very thorough in many ways, study of how cost sharing in health benefits affected people's use of those health benefits and how it affected their health. So without going into the complicated details of the study, it was large, it was over a period of time, and its findings wound up taking on a life of its own. First of all, it was studying people at a very different moment in our health history as a country. But secondly, while it had some worthwhile findings, you could go away from it thinking, well, people reduce their use of necessary and unnecessary care, but it doesn't seem to harm their health unless they're poor. Now, in my view, having been in that world, that gave birth to an entire culture, an entire health private sector industry based on making you pay for services to change your behavior. So if you've heard of nudge economics, this was like the early ancestor of nudge economics. Now, part of that, a big reason for it, frankly, is just to save money at this point for insurers and employers. But one of the big features, as everybody knows, is besides the copays, which is the money you have to pay out of pocket, there are the deductibles before you even get any health benefits at all. Now, it just happens to be our bad luck as a nation living under this system that the coronavirus, COVID-19, struck us in the first quarter of the year when a lot of people on private health insurance, those people who supposedly love their health insurance, don't have any healthcare coverage at all to speak of because they haven't met their deductibles. So I'm sure a lot of people didn't get timely treatment because of that. And that's why I wrote that piece, number one. Number two, even now, it's not clear that people will get the care they need or their testing paid for, even though we're promised it will. And number three, what if they get tested and they have something else? What happens to them then? So we need to think about a broken system for healthcare and how to make it better as we struggle through the weeks and months ahead. And that's it for this week's show.